Hey everyone! You know me as Dr. Pimple Popper, always tackling those interesting cases and getting under the skin, so to speak. But today, we're going deeper, exploring a condition that affects many women but isn't talked about enough: uterine prolapse. It's about the support system, the pelvic floor, and how important it is to understand what happens when things go a little south, literally. So stick with me as we break down the causes, the symptoms, and even the solutions. Because knowledge is power, and knowing your body is the first step to taking care of it. Okay, so let's get down to the nitty-gritty. What causes uterine prolapse? Well, imagine your uterus like this little beanbag, nestled comfortably in your pelvis. It's held in place by a network of muscles and ligaments, your pelvic floor. Now, if those muscles weaken or those ligaments stretch, our little beanbag uterus can start to slip downward. This can happen for a number of reasons. Childbirth, especially vaginal deliveries, can put a lot of stress on those pelvic floor muscles. Aging, menopause, even genetics can play a role in weakening those crucial support structures. And don't forget about chronic pressure. Things like heavy lifting, chronic coughing, even constipation can contribute to the problem. So how do you know if you have uterine prolapse? Well, sometimes, especially in the early stages, you might not even notice anything. But as it progresses, you might start feeling some telltale signs. One of the most common symptoms is a feeling of pressure or heaviness in your pelvis. Imagine carrying around a bowling ball down there, not a pleasant feeling. Some women actually feel tissue protruding from the vagina. You might also experience lower back pain, problems with peeing or pooping, pain during sex, and even difficulty walking or standing for long periods. Remember, these symptoms can vary from woman to woman, so it's important to listen to your body and talk to your doctor if you feel like something's not right. Chapter 3. Diagnosis. Getting to the bottom of it. So, you're probably wondering, how do doctors actually diagnose uterine prolapse? First things first, they'll ask you about your symptoms and medical history. Then they'll likely perform a pelvic exam. Don't worry, it's not as scary as it sounds. They'll just feel around your pelvic area to check the position of your uterus and other organs. In some cases, your doctor might recommend additional tests, like imaging scans or bladder and bowel function tests, to get a clearer picture of what's going on. It's all about being thorough and making sure you get the right diagnosis. Chapter 4. Treatment options, from simple to surgical. Alright, so you've been diagnosed with uterine prolapse. Now what? The good news is that there are several treatment options available, and the best approach depends on the severity of your prolapse and your overall health. For mild cases, your doctor might recommend non-surgical options like pelvic floor exercises. Kegels, anyone? Losing weight if you need to, and avoiding those constipation triggers. Sometimes a little device called a pessary can be inserted into the vagina to help support the uterus. In more severe cases, surgery might be recommended. There are different procedures available, some minimally invasive, to help reposition and support the uterus. Chapter 5. Prevention tips. Keep things lifted. Let's talk prevention. Just like with those pesky pimples, sometimes the best approach is to stop them before they start. So what can you do to keep your pelvic floor strong and healthy? Those Kegel exercises we talked about? They're not just for after childbirth, they're like a workout for your pelvic floor and can be done anytime, anywhere. Maintaining a healthy weight can really help reduce that pressure. Finally, don't underestimate the power of a high-fiber diet. It'll keep things moving smoothly and prevent constipation, which in turn helps protect your pelvic floor. Outro your body, your knowledge. So there you have it, the lowdown on uterine prolapse. It's a condition that many women face, but it doesn't have to be a silent struggle. By understanding the causes, symptoms, and treatment options, you can take control of your pelvic health. Remember, knowledge is power, and knowing your body is the first step to taking care of it. Don't be afraid to talk to your doctor if you have any concerns. They're there to help you live your best, healthiest life. And hey, if you found this video helpful, give it a thumbs up, share it with your friends, and don't forget to subscribe for more informative content. Until next time, stay healthy and informed. Thank you for watching.